Can you see the screen, the blank screen? Okay. So basically, I will tell you the story about two girls, and they are best friends. Let's suppose they are Elsa and Ella. Okay. So Elsa is she loves her best friend so much and is very excited about Ella's birthday, and she was preparing a handmade gift for her best friend. So basically, they were like best friends from, let's suppose, 11 years, and it's Ella's 15th birthday. Elsa is super excited about it, and she's going to her birthday party. What happened there wasn't expected. So someone knew Ella's love for pets, and he gave her a kitten for her birthday. So it was a very small white kitten, a blue-eyed kitten, and about one kilo or smaller حتى. So she was super, super tiny, super small. When Elsa sees the kitten, she was super terrified. She was afraid to death, and she left the party. What happened next was that Elsa couldn't come to her best friend's house for about 1 year and a half. Almost 1 year and a half. She was super afraid of the cat. And even after Ella gave her cat away, Elsa couldn't come to her house. She was super afraid of it. You might be thinking now, what is this story and what's the concept behind it? So basically, it's a true story, and it's my story with my best friend. I had a best friend that I loved so much, and I couldn't go down to her house that is uh, downstairs because I was super afraid of the kitten that she got for her birthday. And we were no longer that much close after that incident because it was super hard for me to go down to her house. So this is my story about phobias, and that's why I like to speak about this topic so much, because like I literally live in it. Yeah, me too. Thank you. Thank you. Okay, we share so much. So we will speak about phobias, but before we start about this topic, we will dive deeper into fear, because people tend to have a problem in the differentiation between what is fear and what is phobia. Fear in general, it's an emotion that we feel when there is an alarming situation, when there is a threat, when there's something that basically is dangerous for us. So we do this physiological reaction that our body trigger. It's a fight or flight reaction because we tend to want to live and we tend to take actions when we feel threatened. This is the definition of fear. While a phobia, on the other hand, it's an exacerbated and an irrational fear. So it's a situation where we fear something that is not life-threatening. There is no problem in this situation. We are not having a danger, or we're not put in a dangerous situation, but we fear it. We fear it like irrationally and in a very, very intense way. This is the general definition of phobias. And the definition of specific phobias is the fear and the anxiety about a specific object or situation. For example, in my situation, it was the kitten or the cat. So this is the definition of phobia. So basically, it's being scared, but it's not the usual or the actual level of fear. It's an exacerbated, it's a super increased level of fear. The differentiation between fear and phobias is super essential to understand what people really feel when they say I fear cats. It's not the usual fear. So I fear a cat when she is jumping over me, she's trying to bite bite me off. I don't know. It's a fear when the cat is away, she's not putting any threat, there's no problem in this situation, there's no real danger. So the main differentiation between fear and phobias is that fear is vital. It's usually present during real danger. Whenever the danger is not present, the fear is not felt anymore. It's an instinct. So we all have fears. All of us here have their fears, but not all of us have phobias. It's about 8 to 18% of the population, of the US population. Fear, it's a mild to moderate anxiety. So it's a feeling of anxiety that is not exacerbated, while phobia, on the other hand, it's a very intense, very high anxiety level. So this is the main differentiation between fear and phobia. What are phobias now? Phobia by the DSM-V classification fall under the criteria or under the classification of anxiety disorders. So it's basically an anxiety disorder because what's common between phobias and anxiety is the word anxiety. So people who have fears, who have phobias, they have a very tense anxiety feeling. And it's also linked to the avoidance behavior. We will speak about it later on. So basically, that's why phobias are under the criteria of anxiety disorders. And DSM-V classifies phobias into two main categories. There's the simple phobias, which are the specific phobias, and they are called to be simple because usually we know what is the trigger here. So what's the object, the situation, what's the problem exactly? While complex phobias, on the other hand, such as agoraphobia or social phobia, the trigger here is much more complex. So we do not know exactly why the people have this specific situation. We know that they are phobic to speak to people, but for agoraphobia, for example, it's super linked with panic attacks. And we do not know exactly why this phobia developed or to what object exactly they developed it. So this is the main differentiation. Now, our topic today will focus on specific phobias especially, and we will talk about these phobias. So what are specific phobias? Specific phobias, as we defined it, it's a fear or to be phobic in a specific or for a specific object or situation. And it has 5 types. There's the environmental phobias or phobias related to environmental factors such as deep water, heights, fire, etc. Animal phobias, and I fit into this category, including fear of dogs, snakes, or spiders. Situational phobias such as fear of flying and going to the dentist. Bodily phobias. Okay. Bodily phobias, it's the fear of blood and injections, to see blood, to be injected, to be vaccinated, to see a needle, etc. And the other category, which is a very specific category, and it has all the phobias that do not fall into the previous 4 categories. And you might think, what could be this phobia? So basically, there's people who have colorophobia, and it's the phobia of clowns, for example, and it does not fit into the 4 categories, previous categories, so it has the other category. Those are mainly the types. When I was searching about phobias and reading about them, I found that there is like more than 100 types of phobias. There's a very specific types of phobias. For example, there's fears of buttons, fears of tomato, some people fear mustard. There's a very kind, weird and kind specific phobias, but there is the most common ones. And what are they? Claustrophobia, for example. And this is something that we as a professional or as physicians should take care of, because claustrophobic people could not go into MRI machines. They are super afraid of it. They are super afraid of enclosed spaces. So we should take care of it. Aerophobia, it's the fear of flying. Arachnophobia of spiders. Emetophobia, it's the fear of vomiting. So some people just fear to vomit. They cannot vomit and they are super afraid to vomit. Erythrophobia, it's the fear of blood products. Zoophobia, it's the fear of animals. Aquaphobia, it's the fear of diving into deep waters or deep waters. And acrophobia, it's the fear of heights. So basically, these are the most common types, but there is like more than 100 types of specific phobias. What are the causes and origins of phobia? So we might think, why? Why do people develop phobias and other people do not? Basically, there are many theories about phobias, but till now we do not have like a specific course of disease. We will like fly over them. There is the theory of preparedness, and it takes its origin from our ancestors, and it says this theory say that we fear things because we used to know to differentiate what causes great danger for us in the past. For example, spiders, snakes, animals, etc. And because we wanted to live, we developed this reaction to fear things that could be threatening to us. And this theory failed because it could not explain why do people fear things that are not dangerous or they do not like impose great danger. dual process model, it's also a theory, and its main model says that we have something that we call the stimulus and something that we call the factor. So whenever for example, if I have a dog and I seen a dog that attacked someone else, so I will directly link what I felt in my body. So I felt an anxiety, I had a very bad palpitation, high blood pressure to the dog, and I will link the stimulus to the reaction. So whenever I will see a dog, this will make me develop the same reaction. And that is a theory of phobia development. It didn't have a huge success because it did not explain why do people fear things that they did never encounter, that they didn't have any reaction, they didn't witness anything related to them. So it was also a theory that was rejected. Okay, so for our days, what we can say, the phobia development doesn't have any specific course of disease. We do not know exactly why people have phobias. It's multifactorial, and most individuals, including myself, doesn't know why they have phobias, what was the specific situation, or at what specific moment they developed this fear. What could it be? It could be genetic, and this comes from the fact that many phobic children have a phobic parent, so they link it to genetics. For now, we do not have any specific gene that can explain it, or we do not know how it develops. Traumatic events, for example, if I experience an attack from a cat, I didn't, but if I had a cat attacking me, I would develop this phobia, I would develop this fear. Witnessing an event, so if this same cat attacked my sister, for example, I could develop a fear from the cat. And cultural, and the culture here speaks what is the learned behavior that we put in children's mind about animals, for example, snakes. So we always tell children that snakes are not good, they are evil, they can eat you. I'm not saying that we should not tell them these things, but it could be the cause of the development of phobia. The biopsychosocial model is the most realistic approach to why phobia develops, although it's not enough to explain why we have phobias. And it links the three factors, the biological, which is the genetic factor, the psychological factor, which is the traumatic event, and the social or environmental factor, which is the cultural events that we have. So it says that the link between the three factors could be the reason of phobia development, but we have no specific course of development, and we do not know exactly why phobia happens. What are the physical symptoms of phobia? And as we said before, when we're anxious, when we're afraid, our sympathetic nervous system is in action. So we have the fight or flight response. And in phobia, they said that we have a fight or flight / freeze response. So people will feel the symptoms of activation of the sympathetic nervous system. For example, dilated pupils, increased heart rate, increased respiratory rate. It could be trembling, it could be diaphoresis or sweating. It could be increase in the blood pressure. So these are the major symptoms for adults. While for children, it might be a bit different. So sometimes children could have tantrums. They could have very bad reaction that adults cannot understand. For example, they can start screaming, they can freeze, they can have very bad tantrum, and we cannot explain why they are having these symptoms, but it could be a reason of their phobias. The diagnosis, and this is what's special about phobias. So what people always say to phobic people is, you have a problem. You shouldn't have this problem, or this is not good, or this is not what normal people should do. And what they do not understand is that we know we have a problem. So phobic people know that this is not something that they should be afraid of. They can recognize the fact that the cat is not scary and I cannot fit in a cat's stomach, but we do not know why we have this reaction. So basically the diagnosis, as per DSM-5 criteria, relies on 7 main criteria. So first of all, it should be a non-reasonable and excessive fear of something that of a situation that is not dangerous, that is not life-threatening. Once we see the object slash the situation of our fear, we should have an immediate anxiety response, an immediate fear, an immediate anxiety. The avoidance is extremely, extremely important. So what phobic people tend to do is that they avoid the situation. So for example, if I am phobic or I'm afraid of cats, whenever I know that there is a cat in this place, I won't go. Abadan. Okay, knowing it's irrational, and phobic people do know that their fears is irrational, that they should not be scared of cats or, for example, of dogs, that the situation doesn't impose any great dangers, but they could not go with it. Life limiting, and this is also a main differentiation between fear and phobias. So let's give another example. Let's suppose someone is afraid of heights, so he does not like to be in a place that is at a great height, but he would go, if he's afraid and not phobic, he would go with for hiking with his friends on a mountain. That's it. While if someone is phobic, he would turn out a job because the office is at the 17th floor, for example. So it's life limiting. They will like live their lives around the fact that we should avoid this factor. More than 6 months, and this is the duration of phobia. So when we talked about fear, we said that when we have fears, we usually tend to have a relaxation when the danger is not present anymore. So if I was attacked by a dog, when the dog is not present anymore, I would be relaxed. I would be wouldn't have an anxiety anymore. While if I am phobic, even if the dog is not present, I have this reaction when I think about the dog, when I feel that the dog is approaching, or I could be just imagining it in my mind for more than 6 months. No other causes of the symptoms. So we have to rule out PTSD, post-traumatic syndrome. We have to rule out anxiety disorders, other disorders that could have the same criteria and same symptoms. So if someone hasn't any other disease, it could be phobia. What is the treatment of phobia now? And as I said before, phobic people tend to know that they have a problem, and usually they are the one that seeks help or care when they see that phobia really is controlling their lives. So there is many type of treatment for phobias, and it's basically therapy rather than medications. Cognitive behavioral therapy is one way utilized in phobia. So it's more specified about letting people know that their emotions aren't valid, that the situation that they are imagining in their head. So for example, when I see a cat, I will directly see it as bigger. She is looking at me with evil eyes. She's coming to hit me. So this situation and the worst case scenario that is built up in my head won't happen. And this is the way that they train people to think about the situation, to act about it, and to feel it. So it's a cycle that is specifically addressed to the fact that you are imagining it all in your head, and it's built up in your head. The other way of treating phobias, it's my favorite. It's the systematic desensitization, and currently it's the first line treatment of phobias. It gradually exposes the person to his fear. So before, they used to think that if I say that I'm afraid of cats and I go to therapy and the therapist will bring a cat and put it in my lap, I will have a shock, but phobia will go away. And research showed that this is not a good treatment at all. It could cause traumatic events for phobic people. And I know I read a story about a girl that was afraid of buttons. So she hated buttons that has holes in it, and she could not like touch any button. But her dad didn't believe her phobia, and he said that if he exposed her to a huge amount or a great amount of buttons, she won't be afraid anymore. So so he asked her to like move buttons from a jar to another. She moved the first one, the second one, and at the third button, she vomited and she lost consciousness. So she was super afraid, super traumatized of the event, and she still has her phobia. So desensitization therapy or systematic desensitization will walk the phobic person step by step to avoid or to overcome his fear. Let's give an example. If someone is afraid of cats, we will start by showing this person picture of cats. So he would be more familiar of seeing cats, and the cat picture itself won't cause any reaction. When we see that he's desensitized of a cat's picture, we will show him a video. So this video will be of cat in movement, and he will see a cat playing, he will see a cat walking, whatsoever, and he will be desensitized for the cat's video, for the cat in movement. Last step will be that we actually will bring a cat for the person. So it would be a step-by-step process, walking the person in baby steps to arrive to the treatment or our therapy goal. Next, we have the medications. Usually, there are some types of phobias. It's rare, but there are some types of phobias that do not go away with therapy. So they take they are very bad that sometimes psychiatrists and therapists prefer to add medications to the therapy or stop the therapy and continue on medications as a sole treatment. So SSRIs or selective serotonin reuptake inhibitors are one of the treatments. Sometimes we can use anti-anxiety medications to relax the person's body or physiological reaction. Tranquilizers such as benzodiazepines, they are now less used, and per FDA, it's not advised to use tranquilizers for phobic people, especially if they had any alcohol abuse disorder, because it could lead to physical dependence. Beta blockers are sometimes used, and beta blockers aren't any neurological medications. They are medications dedicated to the cardiovascular system, but they could be used to decrease the symptoms that someone could feel when he has a phobia or when he has his anxiety attack, when he sees the object or the situation. So that's it mainly. If you have any question, please let me know. And I hope you liked the topic. Thank you. Thank you for tuning in. Thank you.